Hi, my name is Dr. Usmani. I'm one of the dentists here at Delaware Smile Center, and today we're going to be talking about veneers. So veneers, simply stated, they're a thin covering that goes on the front of the teeth. It's almost similar to a covering that might go in your kitchen cabinets or a facing that just covers up something underneath. In terms of when we would recommend using veneers, there's different applications. There can be cosmetic reasons. Oftentimes there are cosmetic reasons where you're looking to change the color or the shape of your teeth. Veneers are a fantastic way to do that. Other times there may be gaps or other things that we're trying to cover up or mask. But ultimately, the result of a good veneer or a veneer case is a beautiful smile that's brighter and younger and more youthful looking. So dental veneers versus crowns. The dental veneer, it's a lot more conservative. It is designed to really just reduce a little bit of the front portion of the tooth over which we'll place the veneer. Unlike a crown, where the crown goes 360 degrees around the tooth. So it's the front, the top, the back, and covers the tooth completely. So the crown tends to be a little more aggressive than the veneer, but it really is dependent upon your tooth. And, you'd really need a full evaluation to decide what the best treatment is, whether it's a crown or a veneer. So the process for the veneers, it's one of the nice things with veneers is it is an instantaneous transformation, meaning you come into the office, we'll get you numbed up, we go ahead, we prepare the front surface of the tooth, as I mentioned, and we make temporaries that day. So you can walk out with basically a template or an idea of what your new smile is going to look like. On the back end, we go ahead, we craft those veneers at the laboratory, and within a few weeks, we get you back and we go ahead and place the final veneers. The veneers and the bonding cement itself. So with the bonding cement, there are different shades of bonding cement. So depending on, what shade you are, we can go ahead and match to that. Oftentimes we prepare the veneer in such a way that the cement actually should not make a difference. And we can use like a translucent or a clear cement as well. Basically, it's a different material type, right? So porcelain we can think of as, kind of like a kitchen sink, a very hard, strong material. Whereas a composite, it's more of a plastic type of material. Both have good applications and indications for use. The porcelain veneer, you're not going to have to worry about color changes in the future. Whereas with a composite, as I mentioned, it's a plastic. So plastic will fade over time. So you may get some color changes. In either case, with a composite veneer versus a porcelain veneer, you'll get a nice cosmetic results, but you do have to be careful of some of the differences between those material choices. So the beautiful part with your dental veneers is it's very similar to your natural teeth. So once the final veneers are cemented in, you'll be able to brush them, floss them, just like you would any ordinary tooth. You don't have to go through any special procedures or use any special hygiene tools to go ahead and clean around them. Just whatever you would ordinarily do for your teeth originally, the same thing you're going to do for veneers. So veneer cost can vary, again, depending on the material type that you're selecting and also location. But as a general rule, you're looking somewhere between $1,500 to $2,500 a tooth. So it is an investment in, committing to your smile or committing to your dental health. And, again, the results are beautiful. So quite well worth it. And I mentioned, the cost for veneers are not cheap. They are, an investment. And as a result, there are different financing companies available that we work with that can help make, that monthly payment into something that is very doable for you. So that way you don't have to wait. You don't have to build up this pile of money to get your veneer started. Come in for consultation. Let's review it. And let's see if there's a plan we can put you on that fits into your budget so you can enjoy that smile today. I wish I could say yes, but oftentimes they regard it as a cosmetic procedure. So just like many other cosmetic procedures, insurance does not directly cover that cost. I think it's probably a better bet, assuming that they're not going to cover it as you're planning and budgeting for your veneers. Well, you can contact us here at Delaware Smile Center at 302-285-7645. We'd be happy to get you in for a consultation so we can review your concerns and any of your options and see what the right choice is for you if veneers are a good choice. And then, as I mentioned, we've got some excellent treatment coordinators who can sit down with you and review financing options or payment options so you can get that smile that you've been thinking about. If you have any further questions or you'd like to go ahead and see if you're a good candidate for veneers, please don't hesitate. Call our office here at Delaware Smile Center, 302-285-7645. and let's get you in as soon as we can and see if you're a good candidate to change your smile.